While we're all stuck at home, I've enlisted the help of a panel today to help consumer goods companies and retailers figure out how they can help. So with that, I'm going to go ahead and turn things over to Doug Rammel, and he'll introduce himself and the rest of our expert panel.
Thanks, Alarice. Hello, everyone. My name's Doug Rammel. What we're going to talk today is part of the Curb the Panic series. What can retail, CPG, and other companies and executives do to help? We're really trying to do a pragmatic discussion of current events and real-world ideas and solutions. What we're really going to try to focus on is what do we need to do now. I want to stress that we all are in this together, and I think you're going to hear from each of our panelists that same message. And ultimately, this is really becoming a new normal. As we try to return to business, I think we're going to find that business as we used to experience it is going to be quite different. 90% of the U.S. population is now under some sort of home protection order. Record unemployment, layoffs, and furloughs. The economy is contracting. And ultimately, all of our technology and operational processes and systems are under stress. So there's some very practical and real challenges that we're facing in remote working and access, dealing with new technologies, obviously the whole operational safety and hazard policies piece, the risk management piece, and staffing. Our panel today, Doug Rammel, formerly Ops and Tech Exec in healthcare and sporting goods. Sally Mason Boemer is the CFO from Mass General. Dean Smith is our public health panelist. And then Daryl Brewster is our industry panelist. Daryl, you want to go first?
Yeah, thanks, Doug. And I'm honored to be part of this panel and to be talking with so many people during this real important time for us in the history of this nation and around the world. I am the CEO of CECP, Chief Executives for Corporate Purpose. And we work with well over 200 of the world's largest companies, including many that you all work with, to really encourage them to be a force for good in society.
Hi, I'm Sally Mason Boemer. So in my day job, I'm the Senior Vice President for Administration and Finance at Mass General. That means I have all the non-clinical functions of the hospital, including CFO. But today, I'd say my job is really, I'm part of the Hospital Incident Command Center. We're operating in an incident command structure. So in that structure, I'm the logistics chief and the finance chief on certain days, trying to help us navigate through this incident. We are organizing what our goals and objectives are for that day and frankly, doing a lot of planning of looking ahead, predictive models of what the surge might look like and how do we anticipate what it's going to be, what supplies we need, what labor pool we need to be able to serve that growing demand. We are up to about 250 inpatients right now, and I would say a significant level of acuity. These days, it definitely is an inpatient and ICU focused and planning for that surge. So that's how we've seen it shift over time. And we've seen pretty much what you've heard nationally, doubling about every 3 days or so.
Daryl, what's changed in terms of your daily life? What have you seen in the operations of CECP, and then what kind of requests and things have you gotten from your members?
We're clearly seeing an impact here that has been both fast and vast. So virtually every job has changed for people across the nation. Our 200 plus companies, companies that are in the midst of this, healthcare companies like Mass General, those who are making food products, toilet tissue. These people are working round the clock trying to keep up with demand, logistics folks. On the other hand, certain industries like travel, restaurants, sit-down restaurants, and others literally have no demand. So all companies have it, but all companies had an impact on this. The differences are really immense. And we're fielding daily dozens, scores of questions coming in from companies asking what others are doing, where they can be helpful, where they can be supportive. And then what we're working is convening companies around topics by industry, by issue, by geography, to have discussions and conversations about what they're doing to get ready, what they can learn from others. Many people just want to be heard. What are they doing? So we can really share best practices.
New Orleans is really in a crisis stage for COVID-19. We have 9,000 cases in the state, 300 deaths, and 2/3 of those are in the greater New Orleans area. Our medical center, nursing school are all hands on deck. Everyone is tapped in working in the hospitals, the clinics, doing telemedicine work and staffing a series of tents outside screening people as they go through. In the School of Public Health, we're responsible for modeling of the crisis in the state and locally. We have students engaged in almost every part of the public health department, which is really strapped itself. Public health is one of those areas that when there's nothing happening, we think it's a terrible waste of an investment. When a crisis happens, why aren't there twice as many of these people involved? And ironically, prior to the start of this crisis, the School of Public Health at L.S.U. and Tulane University across the street are working on a special issue of what lessons we've learned from Hurricane Katrina for the American Journal of Public Health and a September symposium about this. There's a strong volunteer community in Louisiana. So we have 5 websites across the state, including one by the Department of Health, that allows people to sign in, indicate what their skills are, and allow people from the Office of Public Health, the Department of Health, to tap in to pull people into it. On the nursing and medical school side, we have a lot of third-year, fourth-year students that want to help. There's some education that's required, and some people are just too busy to be able to handle the volunteers to bring them on board. On the supply side, I think we're in the same position as a lot of other provider-based organizations. There are supplies there today. We see that there are going to be enough for the next several days, perhaps next Wednesday, and then it becomes questionable. And the question is, will Louisiana be more competitive than Mississippi or Texas or someone else in getting the scarce supplies that are being sent here?
Hey, Daryl, could you talk a little bit about some of the industry coordination that's going on, trying to pull together supply chains as well as trying to supply voluntary donations and those kinds of things?
Yeah, I think this was an effort that really came off a standing start, as Dean said. You know, we were not always as prepared as I think we would have loved to have been, but we are where we are, and we're seeing companies step up in a lot of ways. I think in terms of things along the lines of just awareness, we're seeing the Council of Advertisers and national advertisers really putting messages out there, including the news, to just really help people on the social distancing and other areas. On testing, the test from Abbott looks to be a successful one, and to the degree that can really work, can be really helpful. People like Quest Diagnostics and BD are working on getting those test kits out and completing those tests in a faster rate. PP&E is a big effort for all, and it's just been encouraging to see a number of companies like Hanes Brands or Estee Lauder to really convert their lines to be able to make the gear and kit that's really needed today. And that's happening in really incredible time. Even on the tests that were taking years of getting approval are now happening in a matter of weeks on that. And then, of course, on the medicine side, efforts with people like Regeneron and Sanofi with what may be some medicines that can be very helpful in fast tracking those. Certainly lots of work happening on the vaccine side. And then even facilities where logistics companies, company Limbach Engineering is really helping convert hotels, which have very low occupancy these days, into hospitals, which are going to have very high in certain areas. So it's really interesting to see different companies collaborating and working together to address those specific issues across the supply chain.
What we discovered early on in this incident is we were actually overwhelmed with offers to help, and that's what we called it broadly, offers to help, because they were either people trying to connect us with more established distributors of how we might get PPE, or innovators who are looking to design or retool what they do to help healthcare workers, or employee appreciation, whether it was food or donations to encourage and help our staff. So we instantly realized we need to set up an organized portal for this because we were being overwhelmed. So we set up an electronic web to be the whole input. I've got 7 people working on it per day to help us just sort through how to find the biggest and best opportunities that we can leverage of our scale. And the innovative space is really what's just so exciting, whether it's 3D production of the N95 masks or reprocessing masks, just some really good stuff I think is going to come out of this that'll help the future of healthcare.
Dean, let's have you go first. Just talk a little bit about what 2 or 3 things would you recommend to anyone, regardless of where they're sitting in the country, that they can do to help out?
What we need from the business community is find ways for people to stay in their lane, like do what they do, but do it efficiently and remotely. Relating to what Sally said, we have the hotels in here have stepped up. We have a large homeless population in New Orleans, many of whom are now at the Hilton Garden Inn. It would otherwise be empty, and now they're off the street. They're not spreading. It may be of help to their life. We have some other hotels that are working as short-term, long-term care facilities. When someone is discharged from a long-term care facility to a hospital because of an issue, they can't go back to the long-term care facility. Those are a real hotspot. So now they're at some of the nicer hotels in town. We have the food community has stepped up to help first responders and others in a time of crisis. And a lot of businesses have chipped in to help that. Logistics of getting meals to families who shouldn't be leaving, to first responders who can't leave.
3 areas that we're really intrigued by that also companies are stepping up is how do you now deal with your employees? Recognizing they're in very, very different situations. CEO of Marriott, which is struggling. They've had significant layoffs, but he and senior executives have gone to no pay. They are providing furlough and support for those. I'm on the board of a company. We just increased the wages of, which is making food products. We've increased the wages of our frontline workers, our factory workers by 50%, so that they can have a real incentive to go to work, to continue to be part of the solution here that we're going forward. But addressing employee needs, we think, is critical. Again, having people working remote, something I think we're going to see a real continued growth in that here as we go forward. The other area is communities and how companies can really step up. Sometimes it may be with specific resources, skills, capabilities, and people. Other times it may be money. And I will say in this occasion, the banks, which I think we as a society helped out last time, are stepping up this time. The dollars we're getting are well over $1 billion. The companies have now are investing in COVID. Companies like a Pepsi, companies like Wells Fargo, JP Morgan, MasterCard, all of those and many more have really stepped up with funding that's going to be so crucial for us now. And as we get into phase 2 of recovery and phase 3 of prevention and prevention for the future, all those are areas where we're seeing companies find new ways to step up. And of course, the other is working with the capital markets. And we are seeing companies like Pepsi step up and accelerate payments to businesses that are out there. We're seeing individuals step up and bigger tips to people who are delivering products that are coming into the home since they're not going to restaurants, and really being supportive of those who are really on the front line, not so much in the healthcare side, but in kind of keeping the system operating and moving as well. But the SBA 7A clause really allows companies, which today it's due around these days, but allows companies to get a loan which can be forgivable. So over a couple of months, so they can continue to operate, and encouraging people to apply. I think that's going to be oversubscribed, and the banks are wrestling through that. But it's efforts like that can really help. Also, a lot of efforts that are happening at a community level, and I'm sure that sounds like it's happening in New Orleans, in Boston, where people are getting together to support locals, because again, the local governments, business is where the resources are that can help to support those. So we're seeing lots of actions in those specific areas to kind of keep this economy going now and help on a speedier recovery once we get past the peak and have the health situation in better shape.
I think for the big corporations, I do think there's unique partnerships they can do with hospitals. And so I guess I would say be patient in trying to get through to us, because we've made some really unique connections, people who are willing to turn their operations into scrubs. A neighborhood of ours where they've given us their parking spaces. They're obviously not being used. It was a huge morale boost to our employees that we can allow everyone to park because those spaces were donated to us from neighbor businesses. So I'd say be patient, think of areas of overlap, again, foods, products, or services, and try to make those connections with your hospitals.
Just in terms of wrap up, what we'll be publishing along with this webinar is basically a number of what we're calling references or resources. I would encourage everyone to go to the U.S. Center for Disease Control, the World Health Organization. Sometimes I think we forget about our state, county, city, and local health departments. They're making decisions on a day-to-day basis that can impact how your company runs and how your company can help. And then there's a number of equipment donation coordination sites. There's a number of philanthropic and financial donation sites. There's too many of them for us to list here. We will get them out on the website. I just want to thank everybody for participating. I realize that everyone's busy right now, and particularly for the two of you that are on the front lines, really appreciate the work that you're doing. Know that our thoughts are with you. We're going to get through this together.
Thanks, Doug.
Thank you, Doug.
Thanks, guys.
Thanks, Alarice.
Thank you so much.